Tough one on a campaign in this election year, but, probably not as tough as everything else we have going on with COVID-19. 634, it's the KUAM News Takeover, Guam's favorite. Let's bring Shawn Gumataotao onto the show here. Good morning, Shawn.
Hey, good morning, Chris and Bree. And I think Ken's in the studio this morning, right?
Yes, he is.
Ken.
And just for a little bit of background, Shawn is the former Deputy Chief of Staff to Governor Felix Camacho. He's the head of the Joint Information Center at one point, and he's the Managing Director of GET LLC. Thanks, Shawn.
Hey, thanks, guys, and I'm so happy to be with you guys. And I as we're the other day, we were talking about coming on the radio when we were discussing the 92-year-old survivor, and I was telling Trish, I said, man, I've never seen anything that I've ever shot or edited lead the newscast at KUAM since like 2002. So it was kind of cool, or actually 2003. So it was pretty cool.
Let's just provide a little bit of background because you're also doing work with the Department of Public Health, and that's one of the things that you did.
Yes, and so I'm our small business is providing public information officer support to the department right now, and one of the first projects I got to do is to get a chance to help them find through the public health nurses these survivors, and I got the privilege to meet the 92-year-old Elvira Cagle, and she was such a wonderful young woman, for lack of a better word, and got to meet her daughter, and of course, just telling their story was a pretty big deal.
Yeah, it was. And so, Linda was mentioning that this is just one. I mean, there's 130 survivors now?
Recoveries?
Yeah.
Oh, yes, there's quite a number, and I know we have at least one more of those little photo or video essays coming through soon, and we're also working with other survivors, and so we're hoping to be sharing their story over the next couple of weeks.
Shawn, I think that was a great first one because, obviously one of the running themes for this whole COVID-19 has been protecting our most vulnerable, of course, meaning our manumco. So for you guys to roll out a 92-year-old COVID-19 recovery case as the first one that the island of Guam meets, I thought that was pretty special. And Chris, it was she has had such a great story. Obviously, she talked about just the two places that she went to, and as we were talking a little bit before the interview got underway, she's just kind of doing her thing, on Guam, and it just was a big surprise, obviously, and you would figure the way she was talking to me, she was like 52, I mean, she's just doing her own thing, and just it was a big surprise to her.
Yeah, what did she say? I get my hair done on Fridays, on Thursdays.
Exactly. And so it was, even as I was recording it, I just was just in shock with what I was hearing. But her story, and then also the support of her family, friends, and public health was also a big deal too. And I think sometimes, I know we've heard a lot of different stories across since the start of the response, and some of it hasn't been all great, but this 92-year-old woman, she was really just kind of to help kind of bring it all, home for most of us. I think we've all been home, including her.
Right, and just the fact that, I like the fact that her and Jackie, the daughter, were really just so thankful and appreciative of the phone calls and the constant contact with public health. Because you're right, you don't hear that. You don't hear this care that they provide, and how much a phone call, can impact somebody's life, especially when they're going through something like that.
Especially during these unknown times, right? I mean, they're not that it's not your traditional bedside manner that you're going to see from nurses. I mean, when they're making phone calls, obviously the COVID-19 situation is still very new and very contagious. And so, first responders and all the like are, they're really stepping into some really new territory, and anything can happen. I mean, it's just the same like yesterday. We were over at the last 2 days over at the community testing for COVID, and there's a lot of areas that were taped off, and people to stay away from them, and because if anything happens, obviously we don't want to infect even our own public health first responders. So I mean, it's new ground.
Yeah. So how did you keep it together when you were interviewing her and her family, because I would have been a hot
I
mess.
will tell you, as you and Chris, we all have our Manumco in our lives, and all I was thinking about was all the Manumco in my life, and how can her story get to my auntie or my uncles that would be watching, or my father-in-law that are watching, my parents who are watching from an ocean away. And when they hear a message from a 92-year-old woman who lives in our backyard, and for the most part, she lives in all of our backyards, or down the road from us, it should be that kind of give us pause to do I go to the store today? Do I want to make a left turn and go and check out my friend? And that's, I think, her message. I hope it gave folks who watched it 2 nights ago great pause when they're out doing their activities.
Yeah, and the fact that it really does, the support was from your family, and not just public health, and then their faith, help them get them through this.
Yeah, no, I mean,
you can tell they're really.
I mean, even on your program, the Containing COVID program talks a lot about. I mean, you guys spend a lot of time with Father, what's his name, Father Gofigan, and others who have been coming forward from the Archdiocese and other faiths and talking about the importance of it. Well, for them, for Elvira Cagle, faith is kind of right at the forefront of her life. So it does add that dimension to help her survive,
And good find, Shawn, because I mean Guam is small, and I think all the media has been looking for those recovered cases, or even any positive patients, and people talk about protecting privacy. They've done a great job of that over at Public Health in the response, because we haven't been able to find, almost anybody who has tested positive or recovered. So I thought it was important to get this story and this info out. I was wondering, so we have the recoveries, right? That's the positive side of it, to inspire people that, we can beat this COVID. Are there any plans to maybe touch on the other side? Because we do have people who have lost their lives from this virus.
No, that is such a great question. And I think, and that's also been part of the saddest parts of it, because of the way that the process is involved when they pass. It just seems so quick. Doesn't give a chance for folks to really mourn or to publicly honor them. And I'm hoping that down the road that those 5 individuals who passed, I'm hoping that some way their families, or maybe even our community, can give a little bit of remembrance, because without them, those were the examples that were set, unfortunately, as we're seeing all across America. As these are the examples that are either a couple things that are spurring more research. They are also forcing decision makers to, like in the case of our island, shut down an island and businesses. I'm hoping that they remember those people when they reopen, and then we try to get back to what would be a new normal for life. And we remember those 5 people with each passing day, that hey, this is very real, and our what we used to do prior to something 40 some odd days ago, those times have now changed.
Yeah, as you're right, we're starting to talk about reopening the island, and I know the church is they're putting pressure out there. So I'm wondering if we are going to see some type of memorial or ceremony, and is it going to be something that is done maybe collectively with all the families, or are we going to start to see maybe individual families organize their own? I'm curious, and it might be too soon to talk about it, but it's definitely something that I think about.
Yeah, and just think, Chris, it's not about just those families who, of those folks who died from COVID, but those who passed away during this response period, which made many people go, oh, were they COVID positive or not? These were just folks who passed because it was their time. Had nothing to do with the whole COVID outbreak.
Right. Yeah.
And so those families have also, they've really had to endure. And I think that the community as a group, we all should be very sensitive to that, and just know that what we, while we're grieving, and we might not think about everybody else at that time, but man, in a pandemic, the rules change. But I was thinking about this just about a week ago. Was the church, at least the Catholic Church, and we talked about this with them, or after, was that they've seen this before. If they look at the history books of the Catholic Church on Guam, in the Spanish flu in the turn of the century, priests had to do things a certain way. So when they did it at those times, it was probably not too far off than what they're doing today, advocating for the parishioners, making sure that they're safe, because at the time the Spanish flu did take so many people, including my great-grandfather. So I can attest that some of these stories that you hear from that time are carrying over into today.
Well, Shawn, we wanted to play the recovery interview you did here, just to kind of, I mean, I know we had it in the news, we dropped it on the show yesterday, but again, this is something that it's positive, and I think there's almost weird to say, like a voyeuristic quality to it. It's like you're kind of like fly on the wall listening to this old lady and her daughter talk about how they beat COVID. So we're going to do that. Shawn, is there anything else you want to add in here before we let you go?
No, I just, just like we're all been doing is, continue to encourage everyone to be vigilant during this time. Wear your mask when you're out. Just try to stay home as much as possible. I know there's so many things that are happening, but, wash your hands often. And again, I think her message, I believe it's that hope that we're all looking for to get past this very challenging time in our community and in the history of our island.
Okay. Thank you, Shawn.
Thanks, Shawn.
All right, guys. Have a great day.
You too.
Work as usual.
Well, I thought I was coming.
Great. Appreciate it.
Take
All
care.
right, wash your hands. 6:45. So yeah, let's play this recovery story from the Department of Public Health and Social Services.
Yes, the interview was done by Shawn Gumataotao.
Well, I thought I was coming from the beginning. I thought I was just coming down with a cold. And that's what I just thought, because usually when I have a cold, it just moves right in, it takes over settles in my bronchial tubes. And so I was expecting that, and usually what I grab is Zicam, and I take that during 2 tablets. In the morning it was gone. And then it still wasn't back to normal, the way I thought. And did I have a slight temperature?
One day.
And Jackie thought, no, I better take you to the doctor. We better go check and see for sure. And he put the swabs up my nose, and then we had to wait to send it to Hawaii then. And we had to wait. We didn't get it till Tuesday. And then they called and they said I was positive. And I was expecting always congestion. They keep talking about congestion in the lungs, in the chest, and it just never got real congested. Just one day that I felt a little bit tight.
It's positive. I mean, I could have dropped the phone because I so did not see that coming. He had prescribed for her an antibiotic because one of her lungs looked a little bit iffy on some congestion setting in, and so she started taking that. And then when they called and said, it's positive, we were just all so surprised.
A week before, I was only 2 places because I usually don't go out much at all. And that's why I really thought I was pretty safe. I go to the ladies' Bible study on a Thursday, and every Friday I go to have my hair done, to shampoo, and she sets it.
Something's come into our lives that I didn't want, and it was maybe fearful about. And of course, our children were saying, Mom, if Grandma gets the virus, Mom, if Grandma gets the virus, it's not going to be good for her. We could not have her. And, you're aware of all of that. And yet, what can you do? You do your best and know God does the rest. And so it's ultimately in His hands. Our health always is, every moment of every day. So all of a sudden that comes home to you and your mind just starts going, okay, what does this mean for all of us? And especially, what does this mean for her?
It was sort of in a way scary, but I felt so good having Jackie with me. And then we had access, they call from the health office, that really meant a lot too. That we knew if I did really something happen quickly, we had somebody to get in touch with. So really appreciated the girls in the health office that were calling and trying to be of help if we needed it.
But really, there was never a fear of ourselves, and it was just trying to care for her, knowing that this could really be a difficult thing at 92 years of age to fight this strong of a virus. And so that's just what we did. We really started going through. And I'll tell you, one of the biggest blessings was that we didn't have to send her anywhere else to isolate. And at first we got that message. And when I heard that she was going to have to leave and go somewhere else, and we wouldn't even be able to visit, I thought, oh no, that in itself, if anything, will be her downfall right there. She's so used to being with us, and we're used to being with her and caring for her. And without even a visit, I knew that would be so hard. And we prayed that night, God, you're in control of all of these details surrounding this whole situation. You've allowed it. You have a plan for it. And so you show us.
What are your general thoughts on how public health supported you and your family?
They were very, super supportive right from the get-go. We started getting calls. We started hearing their concern. And they wanted to know whatever they could do to help us. That was really a blessing to us. Although we have some people around us that were willing to go to the grocery store and bring it to our door and drop it off or whatever, they were asking if they could do that. Can we get anything for you? And they checked in. My mom got 2 calls every day, morning and afternoon, to see how she was doing. The rest of us each got our own phone call to see how we were doing, always reassuring us what to do in case we had any symptoms, what to do if my mom's symptoms grew worse. And so we always were in the know, and we were always very supported by a group of people who were there for us at just a phone call away.
Now, we saw Nurse Kim earlier, so how has public health been in terms of your support to you?
Oh, I'd say very good. They're very good, very helpful. Just giving you a good feeling of knowing, well, they know more than we do. In the event that I did feel I really ran into some problem, but so it was just a support that meant a lot, and really we appreciated it. And if Jackie had any problems or something, because this was the first adventure for us, and I didn't hear of anybody else going through it, so we couldn't go to somebody else that had experienced it, and it was new, and it was an uncharted journey.
Recovery story there.
Elvira Cagle and her daughter, Jackie Nagencast.
Let's go to the phones here. We have one of my favorite doctors in the whole world, Guam, Dr. Vince Akimoto. Morning, doctor. Good morning. I haven't heard from you in a minute. How are you?
How you been?
Yeah, you guys sound tricky this morning. Well rested. I'm enjoying listening to you.
Oh, thank you.
I slept really good yesterday.
I didn't.
Yeah, he woke me up.
Yeah.
Like, hey, did you see this? I was like, I'm sleeping.
Bree took a nap at like 6 o'clock, and then the whole world went crazy, and she woke up at 9. She's like, what'd I miss? I was like, well, how much time you got?
Well, so one of the reasons for the call, we were up late last night, too, talking with Dr. Mike, Father Mike Chrysostimo, Pali Mike, member of the group of Catholics who are trying to, work within this whole COVID-19 lockdown situation, which yesterday, I guess, added to the drama was an opportunity to perhaps allow the community to return to some form of normalcy. But I think the public health director, again,